Good. All right, so today what we're doing is we're doing a test prep workshop, and essentially what it's going to consist of is I'm going to teach you how to take a test. I'm going to teach you how the test is actually built, and I'm going to teach you how to look at each individual questions. So not all questions are asked the same. Not all questions are going to require the same answers. You're going to see the same question probably multiple times, but each time you see it, it's going to require a different answer, because they look at the whole bit of the information, and then from that point they take out different aspects of what they want you to know. All right, so there's absolutely no magic pill whenever it comes to this, and you have to know the material. Whenever you're studying, you should be uncomfortable. If you're not uncomfortable whenever you're studying, you have an issue, and that issue is you're getting into your comfort zone, and that's where you're staying. Whenever you're studying, you don't want to study the same thing over and over and over again, because what that's going to do is that's just going to reinforce what you already know. Okay, and that's what the trap that a lot of people get in is they like to feel like they know what they're doing. All right, and that was one of my biggest struggles whenever I got into my critical care stuff, is because the very first test that I ever took, I made a 28 on it. And that was the point that I was like, I don't know if I should be doing this anymore. All right, but I didn't know the material, and now that was my issue. Okay, you have to study what's pertinent and what's important, and what's important is really the bulk of your textbook. However, you can divide it up into pieces. Okay, whenever you're studying the main points, whenever you know the basic anatomy of each and every body system, what that's going to do is that's going to allow you to be able to troubleshoot and problem solve your issues. And that's why the anatomy is that foundation. All right, and you have to be able to identify your own strengths and weaknesses. If you can't do that, then that's going to be part of your problem. Because I don't want you guys to be like some of the other people that have contacted me that have, tested 3, 4, or 5 times, and they're right there at that last attempt before they actually reach out and ask for help. And because at that point you have 1 attempt left, so you have 6 attempts total to pass it with this course. I don't expect anybody in here to use their full 6 attempts, but if you do, and you fail that 6th attempt, you're going to have to retake the entire program. Now, so what that means is if you're at your advanced portion, that just means you have to retake the advanced part. If you're at your basic portion, you have to retake the entire basic part. Does that make sense? Okay, but we don't want anybody there, so identify your weaknesses early. Know what you're strong at. Like for me, I was really good at OB and cardiology, but operations is my weak point because I don't come from a firefighter background. And it took a lot of me reviewing the concepts of operations and talking with people before I ever even had a basic concept of it. And so plan your studying time in manageable blocks. And the way that you do that is you have to know when you're testing, right? And knowing when you're testing and knowing how much time you have is incredibly important for this aspect. And so, is it okay if I bring that board up here? Okay, cool. Cool. All right. So, what I'm talking about, start studying early and plan your stuff. And plan your stuff into manageable blocks. So there's this method called the. Can we also see that? Okay, cool. All right, so it's called the Pomodoro method. And it's this really fancy way of saying that you should study in manageable blocks. Okay, so break your time up. All right, and so this green does not want to come off. Okay, so what we have is, so let's say, how much time do you guys allow yourself to study at a time?
I can only do like 45 minutes.
Okay, so 45 minutes. All right. What else? Is the answer 0? You stay for a whole day? Okay.
I'm like our last Paul and John.
Okay, perfect. All right. Absolutely. No, I'm with you guys on that one. So there's at least 3 that are on that. How about you guys? Do y'all plan studying time out, or you just kind of sit down and like an hour? Okay, so the way that this technique works All right, so if you you have an hour. All right, it's called a Pomodoro. Okay, and so what this is saying, the way this works, I think I may have told you guys about this before. Okay, so this entire thing, this entire bracket is 60 minutes. Okay, and so what you do with that 60 minutes is incredibly important. It's not necessarily what you study, it's how you. Okay, so what this is saying is in manageable blocks by doing, you got 20 minutes, you do 15 minutes on. Sorry. So you do 15 minutes on, and so at that point, you're not really going to retain everything after a certain point. And so what you're doing is, because does anybody start reading a book, reading a textbook, studying, taking a test, something, and then all of a sudden you just get really bored and you just read the same sentence 5 times and you still have no idea what it said? Okay, I'm like that on a daily basis. Okay, so read for 15 minutes, study for 15 minutes, take a 15-minute test, and then take 5 minutes out. The way that I was able to start doing this is I would get my book, I would study, okay, and then whenever like my washer went off and it was time for me to turn the stuff from my washer into my dryer, I would go down there, I would go do that in the middle of my studying time. As soon as I did that, as soon as I completed my task, whatever that task was, I went straight back into another 15 minutes of studying time. Okay, so right now that's 20 minutes. All right, so that's 20 minutes of studying time right there. Okay, and then what you can do, so we got 15 plus 5 plus 15, that's 15, 5, 20, 35, and then you take another 5-minute break. Okay, and out of that 5-minute break, you go another 15 minutes, but you have to have a task. Give yourself something to do. And this 5 minutes, this is very arbitrary. It does not necessarily mean that you have to take 5 minutes at a time. What it means is you have to do something to completely disconnect you from whatever material you're studying. And then after that 5-minute break, after you complete your task, go back in and study for another 15 minutes. And the 15 minutes, it doesn't even necessarily have to be 15 minutes there either. Okay, these times, they're just guiding blocks. Okay, see, sometimes it'll be 20 minutes, and then you have another 20 minutes, another 20 minutes. So out of that, you have 60 minutes of study time with a 10-minute break or a 15-minute break throughout all of it. And so whenever you do, you just want to give yourself a task: cutting the grass, doing the dishes, feeding the dogs, something, and cover up your book. Take your book completely out of your field of view. Okay? Do not look at any of your material. Shut your laptop. I don't care what it is that you got to do, but completely disconnect yourself away from it, because you don't want to get burnt out. You don't want to get burnt out, and you actually want to be able to retain stuff. And if you don't break every now and then, you're just not going to retain anything. Does that make sense? Okay. All right. So I need to start keeping this in my pocket. That's what she said. All right. So flashcards. Does anybody use flashcards?
I start making flashcards and then I get so sick of making flashcards that I quit.
Don't use them anymore.
Right. Okay. So do you actually use after you do them? Okay. Perfect. All right, Thomas.
I do a lot of them.
You okay?
I see the spiral bound ones.
So you just flip them through them?
Yeah.
Okay.
But I'm visual. So
Yeah. Okay. Well, flashcards. I tried using flashcards. They don't work for me at all. All right. And so, but here's the thing about flashcards: you find something that works for you, and you kill it. Like, you murder it till it's dead. Okay? And you do that same thing over and over and over again because you found something that works. And that's the important part about this, is because if you guys are just coming straight out of high school, or you didn't go to college or anything like that, or even if you did go to college, you may not necessarily know exactly how to study. All right? Because this material right here, A, you either know it or you don't, and B, if you don't know it, you can kill somebody. Does that make sense? So that's why this is really important. summaries and notes. The way that I study is I take my book and I write. I write in the book, I write in the margins. And so I take my notes in there and then I'll underline keywords. That's what works for me. I know somebody, a real good friend of mine, what she did was she would take the textbook, and you know how the textbook is written in those $5 college words. It's really fancy like, right? What she would do is she would open up a Word doc, read it, and then put it in her own words. It's the same content, it's the same material, except in her words. So whenever she's studying her notes, she's seeing her exact words. Does that make sense? And so that's the way that she was able to help her retain that information. Now, before the test, all right, before the test, you cannot, there's a couple things you can't do, okay? You don't need to cram unless it works for you, okay? Again, so this goes into finding what works for you, okay? And always get a normal night's rest, all right? And so I'm bringing the whiteboard back up here for just a second. So what you have is, you remember a couple slides back, I told you, hey, so know when you're testing. Go ahead and plan that out. Okay, the reason for that is incredibly important because if we look at a calendar, this black don't want to work. Okay, so if I'm looking at a calendar and it's a 1, 2, 3, 4, 5, 6, 7, sure, something like that. Okay, and I know that my test date is going to be right here. So this is my test date. Now, if this is my test date, and right now I'm starting up here. I know that I have 1, 2, so that's 14 days, 15, 16, 17. I have 18 days until I test, if we look at this as a traditional calendar. Does that make sense? Okay, and so what you do with that, what you do with those 18 days is what's going to make or break you, because what you need to do, you need to do one thing a day. Okay? So that Pomodoro method, or whatever it is, remember, the times are arbitrary. You don't have to study for 15 minutes. You can study for 30 minutes. But as soon as you start getting tired, give yourself a task, have something to do, change the litter box, feed the pets. I don't care what it is. Go to the store and buy some fruit gushers. It doesn't matter. All that matters is that you're doing something to get away from it, okay? So you're doing the Pomodoro, and then you're gonna study OBGYN. All right, that's what you're doing that entire day. Do not do anything else aside from OB, okay? And then your next day, you're doing operations. All right, and then so let's say you take a day off, all right, and then now you're going to do trauma. Okay, and the reason I'm OB, ops, trauma is because these are your national registry categories. Okay, and then so your next day you can do medical, which OBGYN kind of fits in the medical, but OBGYN is its own little category altogether. And so part of that medical, you can say that you want to do cardio, or I'm sorry, you want to do neurology, so neuro and endocrine. So neurology, endocrine, that's going to be diabetes and things, okay? And then you can also get into like your metabolic disorders, but those are all in those chapters of your textbook, okay? And then after you do your medical day, you want to go in and you want to go do cardio. Do respiratory. Take a couple days off and then do trauma and medical. And by the time you make it through all the way to your test day, which, and let's say that we leave this entire day open prior to our test day where we're not doing anything, you have covered the entire contents of your book as long as you've planned it out. Okay? And this is important because what happens is you set your test date, you set your date for, let's say, March 12th, and then March 1st comes around, it's like, oh, you know, I got 12 days. No, you're already behind the ball because you should have been studying it in these manageable this entire time from the moment that you set your test date. Does that make sense?
That's a good thing, I guess, since we have so much use with Canvas, is that we can kind of I don't know, force them in a way to
Yes.
follow this thing by staging quizzes.
Correct.
Stacker.
And that's what I did. This is what I do with my last class. And so I was able to kind of do it and break it up into those manageable blocks. All right. So does this make sense, guys? Okay. So whenever it is that you schedule your test, try to incorporate this in there a little bit.
So using the Pomodoro method, can you use it for multiple hours at a time? Because I know
Yes.
you can't study trauma for just an hour. It's going to have to be like a 4 or 5 hour thing. So
Correct.
do you just break those 4 or 5 hours up
Yes.
by those 15-minute blocks?
Yes. So you break it up into the content and the task. So as soon as you're getting into content, so like let's say you want to focus on chest trauma for 15, 20 minutes. It really doesn't take that long to go through something unless you're reading every word. And at that point, you really kind of need to be skimming
So
over.
focus on that task, take a break, go to another
Yes,
concept, take a break, go to another. Okay.
correct.
You just quit absorbing after a little while.
Yes, because so just like how a sponge, like if you're using a sponge at while you're doing the dishes, you can only use that same so long before it soaks up so much water. And your brain ain't really a whole lot different. Okay, but do not cram before the test unless that works for you. If you've practiced cramming for the test, then cram for the test.
Some people it just stresses them out.
Correct. Now, avoid the depressants and avoid the stimulants unless that's you. If you're a caffeine addict, stay on the caffeine. Okay. If you're an alcoholic, I would really like it if you would kind of like back off that a little bit, but
both.
I don't know. Test where you're comfortable. All right, and that's the big thing about this is you have to know you have to prepare you for this. There's nothing worse than getting somewhere and wanting to do something, and then all of a sudden your stomach starts killing you. Okay, unless you're taking something to kind of suppress your need to eat. Okay, and even if you don't think you're hungry, just go ahead and like eat a banana, eat an apple, eat something small, something manageable. That way it's going to buy your stomach a little bit of time to get past wherever it is that you're at. Does that make sense?
Another thing too, the more after you eat something, what's your body having to work itself to break itself down?
Right.
So your metabolism's working faster, everything's got better blood flow, so you got more blood flow to the brain, so you think better.
Yes. And another thing, so does anybody here chew gum? Okay, you can chew gum in the test. You can't bring mints into the test with you. Okay, something that I do whenever I go take a test, I have this very specific brand of gum. I use 5 gum, the green. I don't remember what it's called, I just know that it's green, so 5 green. Anytime I'm studying, I'm choosing 5 green. All right, anytime I go take my test, whenever I took my paramedic exam, I was chewing 5 green. Whenever I took my flight paramedic exam, whenever I took my critical care paramedic exam, I was chewing the same piece of gum every single time. And so what that does is that builds a familiarity with it. Okay, and so familiarity with that flavor for that specific task, and what it does is it's going to help stimulate your thoughts while you're doing that. You can look at it as a placebo effect, where maybe it really doesn't do anything, but maybe it does do something. But if it does something to you and it makes you feel better, then that means that it's actually accomplishing something. Okay. If you have to travel, consider a motel the night before. So if you're having to travel, 100 miles, I don't know where you guys live or anything like that, but I like to go to Auburn. It's a 2.5-hour drive from here. That's manageable to me. But if you think that you don't want to have 2.5 hours to go, you just want to kind of get there, study, hang out, and live there for a moment, then go do that. Whatever it is that you think is going to make you comfortable. But do not study right before the test. There is nothing that you're going to see on a sheet of paper moments before you walk in, aside from disorganized words. There's nothing that's going to be life-changing. There's nothing that's going to pass that test for you right before you do it. And what's going to happen is, like, let's say that you read over your note card and you say, oh man, I forgot all about that. Well, now you just down yourself. Now you're causing doubt within yourself right before you go into your exam. And that's not good. We don't want that. All right. Now,
You don't believe that? Watch registry.
Yes.
Practical registry. You can sit in there and watch people nut themselves up, trying to cram last second before they go to the station.
That's it.
First thing you can do.
Now, so I want you guys to read this right quick. All right. So, finished files are the results of years of scientific study combined with the experience of many years. It's a really complex little organization of words. So now here's the thing. How many F's were on the previous slide? Did you guys know the question before you started looking at it? No. So you have to know the question before to know what you're looking for. If you look at the answers first, you're going to catch yourself into a trap. Okay, because the answer is going to say BVM, and you're like, oh, BVM is always the answer.
Yeah, so they're already.
But
before they even start.
somewhere else it says suction, or it says C-spine, or it says call for additional resources. Something that comes up way before airway does, or way before breathing does. Does that make sense? So you have to read the question. You have to know the full context of the question. You have to be able to look at the information that the question is giving you, know what the question's asking, and then look at your answers. Okay? And knowing the content, knowing what the body of the build up to the question, and then looking at the question, what the question's actually asking, because the question itself and what the question is asking may not necessarily be the same exact things. Okay? Because there's information in the question. Now, so be sure to select a seat with minimal distractions. At Auburn, they have this little room that they can put you in. It was super nice. Avoid the windows, drafts, friends. Kip was not my friend test day.
No.
Okay, my buddy Hector, he was not my friend test day. All right, because we sat separate from each other. We talked before. I was like, all right, good luck. He said, good luck, and we went and go tested. And that's how it went. Okay, but friends don't let friends drag each other down. All right, and it's really important. Do not read into the test. There is no subliminal messages. There's no Illuminati. All it's doing is it's giving you the information, and it's asking you a question. Do you know that question? Now, you're going to have a lot of people who are going to be like, well, there's more than one right answer. Yes, there is more than one right answer, but there's something that comes first. There is always only going to be one correct. If I were to take that one correct answer out, then yes, I have more multiple answers or more correct answers from there. But there's always going to be one, and you can only select one. Every question that you get is going to be A, B, C, or D. Okay, you may have a true or false. I think I had one true false through all the tests I've taken. I've had one true false. All right. Now, what time is it? 9:51. Okay, so we've been going for 20 minutes. All right. So, how do you guys feel about where we're at?
This is a breakdown.
Oh my.
That's what this is. Because I just took a break from the material to ask you guys a question. So now, so what does anybody think any of that stuff? Or like, I see everybody taking notes.
I
So
have a thought or a question.
Yeah.
So, I'm one of these people. I think that cramming is better for me.
okay,
But if I really did this, I would probably be more successful.
right.
So how to encourage those students who think that cramming is
Got to break them down.
So so it's like
You got to disprove their theory.
right. So now alcoholics, for example. So if you have somebody who's an alcoholic, there's nothing wrong with that. So, but if it's called the pregnancy, yes. Okay. So now what happens if you have somebody and like so like let's say Kip was an alcoholic and you wanted him to quit. Is he going to want to quit unless he wants to quit? No. So that's the thing. So if you're doing the same thing, so definition of insanity, does anybody know it? Yes. So doing the same thing over and over and over again and expecting a different result. If what you're doing ain't working for you and you don't incorporate something different, then clinically we can say that you're insane.
I mean, basically, how I do it, if I get somebody who's stuck on something that they think that they're smarter than they really are,
Right.
I'll quiz them until they realize they're not.
Absolutely. And I'm a very big believer in be humble or be humbled. And I would much rather you guys be humble now than take registry and be out a couple $100, however much it is, okay? And then all of a sudden now you're down on yourself because you have 15 additional days before you can reschedule it, okay? So be humble now, take in new things, or be humbled whenever you fail the test.
Arrogance is a big problem.
Arrogance is not a virtue.
No.
So, but does that answer your question?
Yeah.
There are obsessive people that do study and learn better there. I go insane learning in 20-minute blocks.
Mhm.
I couldn't do it. So it's not necessarily that it's wrong. And you may be one that's just always done it out of a
Well,
habit.
I'm kind of a, like, I've never been a
Mhm.
big studier anyways, but I do it the day before, but I have to take like that whole day and I do it in.
Right.
person.
Yeah,
And see-
I'm the same way.
But I
I'm
wouldn't
Friday.
necessarily, it's like cramming, but not cramming.
Right.
So it's not like 5 hours before the test and I'm trying to soak it all in. It's like a whole day before the test, but I don't do anything up until that day before the test.
Right. So, and what the thing about the Pomodoro technique is whenever a lot of people see it, a lot of people read it, they say, oh, it's got to be 15 minutes. It's got to be 20 minutes. It doesn't have to be that. It just has to be a task.
When you start feeling like it's not going in anymore, you stop.
You need to stop, do a task, do something different.
Well,
and then come back at it.
college and everything. You know, I a long time tried to figure out how in the world I can make all that stuff work because I was trying to learn things I wasn't interested in.
Right.
If you're not interested in something, it's very
It makes it
very
difficult.
to make it go in. But I mean, I was like that. I had to get up, move around, and just do some random stuff just in between studies to make it work. I remember being in Auburn, studying in grad school, and just going up and walking up and down the steps, walking from one end of the library to the other.
Mhm.
And when I got back, I sat down and went back to work again. And then
It's a lot.
when I felt it going away, I had to do the same daggum thing again.
Get
Go
up,
down the
walk,
elevator.
all that.
It was a constant fight to make that stuff work. My attention span is like 2 minutes. So.
Right.
It's
Now-
bad.
All right, guys.
That makes
So-
sense.
Everybody do me a favor. Look up at me for 2 seconds. Okay. Look at your phones. Go ahead and get them out the way. Look at your phones. Okay. Or whatever it is. Look at something. Okay. And get your attention
Back on you.
back on up here on what we're about to be going over. Joel, what you got?
To your point of how you make people do it, I was a crammer before I took Jeremy's test taking class a year and a half, 2 years ago.
Yeah.
And as I was studying one day and I'm reading, the words start blurring and I start thinking about what's the tire pressure. And I went, maybe it's time to take a break. So I get up and I do the bad thing, I go get something to eat. So if you're eating every 20, 30 minutes, study will put weight on you.
Yeah, you bring some flesh.
Right.
Get up, do jumping jacks or something, I'll do better. But yeah, you don't really have to force people to do it if they know that's an option. And
Right.
Yeah, I think that is a good thing.
the words are going to start getting blurred.
Absolutely.
You'll go, maybe I'll try what Jeremy said.
Maybe Jeremy was right.
Is I'll be like, okay, I can watch like a couple minutes of Netflix, and then
Right.
I'm 3 episodes in.
Yes.
I don't want to stop.
Yes. Now, see, that's why you have to give yourself a manageable task.
Yeah,
May-
don't take that.
Set your
Right.
Pomodoro timer for your brain too.
Right.
Whether you're using an actual Pomodoro timer or a timer on your phone, just set the timer for your.
Yeah. Absolutely. So take your phone out because it's got this stopwatch thing, whatever timer. Hit 5 minutes, 10 minutes, 15 minutes, whatever it is, but make sure that you stick to it. Because if you don't stick to it, it ain't going to work.
For that gum thing, the same flavor.
Yes.
I've been doing that for a minute.
Yes.
It was only just for nerves, and it
Mhm.
goes for that much.
Yeah,
It's for the same
absolutely.
task.
Again, so, it may not do anything or it may do something. It just depends on you. If you think it's working, that's it. I think that it works.
I definitely suggest Auburn as a testing place though, because you do have your own little cubicle and there's no distraction.
And they're super chill there.
Yeah.
Mhm.
Because I've been to other places where you're in a room full of
Treat
people
you
and
like a
it
prisoner.
can get distracting.
Yes. All right. So we're ready for this next part? We're going to go through this next part and then we're going to go on a break right after. Okay? So phones out the way. It's awesome. All right. So critical thinking. This is what gets a lot of people. This is what gets a lot of people in trouble. This gets you in trouble whenever you're taking a test. This gets you in trouble whenever you're at work. This gets you in trouble all the time. Okay? So critical thinking is your ability to think clearly and rationally about what you have to do next. Okay? And we use critical thinking to analyze and assess and decide our course of action on how we're going to proceed. Okay, but you take in all the information and you have to take everything in and pick out what's important. Okay, the more you use it, the more you practice it. If you practice what you preach, you're going to reap the benefits. Okay, so it's self-guided and self-discipline because you can cruise through the motions. You can go through all the motions, pass all the tests, and never critically think at all. You're always looking at the next person. It's like, oh, I'm just going to copy what they're doing. And that's it. Okay, that's going to bite you in the butt whenever you're the one that's in charge. Okay, or maybe your paramedic gets sick one day while they're on a call, and then all of a sudden now everybody's looking at you because you're the one that's been working with a paramedic, so you should be familiar with it. Okay, and it's going to get you in trouble in registry because critical thinking is what gets people in registry. All right. Critical thinking is thinking about thinking. Okay, you have to actually understand what is going on, and if you just memorize questions and answers, you're wrong. And the reason for that is because you do not adequately understand the material. All right, and if you do not understand the material, you're going to miss the question, because I can take the exact same question bank that we have, the exact same questions, and change every single one of the answers, and it all still be pertinent. It all still be right. Does that make sense? So, and that's why you cannot do that, and registry is going to do that. I got asked the same exact question on my critical care exam twice, except my answers were different both times. Okay? EMT, advanced EMT, paramedic, it's all the exact same way. All right? They're going to take that exact same question, and you're going to look at it and it's going to be like, man, that's the same question. I already answered this once, and now your nerves are going to get you. Okay? And you can't do that. So know that that can happen. You have to be able to analyze all pieces of information and figure out what is pertinent, because there's going to be trash information. Okay? If I know that somebody's breathing 18 times a minute and non-labored, do I really need to be focused on the fact that their breathing's normal? Focus in on the abnormal and clue in. Does that make sense? Okay. Now, and not all information is given is going to be relevant, and that just goes back to that 18 times a minute thing. If I have somebody with a D-stick of 110, is my answer going to be hypoglycemia or hyperglycemia? No, okay? And you have to learn how to filter out the unnecessary. And we're going to go over that here in just a little bit. Now, this right here, this is called Bloom's Taxonomy. All right, and what it is this essentially the building blocks of knowledge. All right, and so I'm going to paint you guys a story right quick. All right, you guys remember way back when? Maybe you don't, and that's totally okay. Whenever you were like 2, 3, 4, I don't know, whenever people start learning the alphabet, okay? But you're learning, you're singing the song, A, B, C, D, E, F, G, right? Okay, so that song, all right, you learn that song before you actually learn the letters, okay? You learn that song, you learn what the letters sound like, okay? And that's what you're remembering. You're recalling the facts and the basic concepts. Okay, so same thing with anatomy. Basic anatomy is you're recalling facts and basic concepts. Okay, so if I say what comes right after the right atrium, you have some people that are going to be like, oh, well, the right ventricle, and then you have some people who are going to be like, oh, the tricuspid valve. Okay, are either one of them wrong? It just depends on what comes next. Okay, it just depends on what the question's actually asking and what the answers are. So if I have a right ventricle and I have the tricuspid valve as part of the same answer, A, B, C, D, which one's going to be more correct? The tricuspid valve, but is the right ventricle incorrect? Does that make sense? Okay, so, and you have to understand that. You have to be able to explain the ideas or concepts. You have to be familiar with the anatomy. You have to be familiar with that specific concept, all right? And then you have to be able to apply it, okay? So we remember the song, and now we're understanding how the song, the ABCD song, the alphabet song, pertains to the letters. And now we're applying those letters by making the sounds with it, making your root words, not your root words, your root sounds, your phonetics, okay? So understanding that A can sound like ah, or C and K, they go k, they can both sound the same. Okay, and whenever you understand that, you're applying that. And then you're analyzing it. You're analyzing the words. You're drawing the connections among the ideas. So you understand that, so if I were, have any of you guys heard of the word gaudy, G-H-O-T-I? Okay, so check this out. Now, if you have a word, where's the markers? They're there. Okay, so this thing right here, it goes. Okay, so we all know the word tough, right? What does the GH sound like? Okay? Now, that's that. And the TI, if we were to, oh gosh, I had the word, and I just lost this entire concept.
Good job.
You need a 15-minute break?
Yeah, you got
We'll come back to this. But, so, anyways, if you look at it, this word, it can spell fish. Fish. Okay? And so the reason for that is because of phonetics.
Like when TI has a
Yes!
connection.
Connection. Gosh, that's the word I was looking for. Okay? So,
You got a big brain.
right, okay, see, you know what? That's why we did this. All right? So, but phonetic, this can say fish, but does it actually spell fish? Okay? And that's because you have to be able to go up to that next step. You have to be able to evaluate the word. Okay? Do those letters go together? And that answer is going to be no. All right? And whenever you're able to do that, whenever you're able to take a chance, so on congestive heart failure, for example, all right, you know that the right atrium goes to the right ventricle, which goes to the lungs, which goes to the left atrium, which goes to the left ventricle. If I have left ventricular failure, what's going to happen? I'm going to have blood that is going to back up into my left atrium, which is going to back up into my lungs, which is going to cause pulmonary edema, which is going to cause difficulty breathing, which is going to cause my patient's oxygen saturations to go low and their carbon dioxide to go up. So now you're going to get asked a word or a question, and it's going to say, what presentation could your patient be, or could your patient present with? If hypercapnic is A, and then you have hyperoxic is B, and then you have hyperglycemic is C, and hypoglycemic is D, what's going to be your answer? So tell me what it's not. It's okay. So tell me what it's not. So it's not hyper and it's not hypoglycemic, right? Okay. Now, nobody immediately raised their hand, and that's okay. All right. And there's a very specific reason that I asked that question. Okay. So that leaves us between A and B. So we have hypercapnic and hyperoxic, right? Okay. So we have a 50-50 shot at this point of getting this right. Okay. Now, hyperoxic, what does it sound like? What is hyper? High or above, right? And oxic, what does that typically refer to? Oxygen. So high oxygen, that's essentially what that's saying, right? Okay. Is that going to be correct? If I have somebody who's drowning in their own blood, is hyperoxic going to be right? So what does that leave us with? The other word, hypercapnic, okay? And what that means is high carbon dioxide, okay? So, but based off of that, there was a word that I did not know, and that was that word that I very specifically picked, which was hypercapnic, right? And so what it did was, you guys knew the three things that it definitely, for sure, 100% was not. And you had the one thing that you knew that it was, or knew that it could be the only thing that was left. Because you were able to evaluate the question. You were able to justify your stance on your decision as to why, based off that information, is it not hypoglycemia? Is it not hyperglycemia? Is it not hyperoxia? Does that make sense? Okay, and they're going to ask you some made-up words as well. All right? Yes, sir.
I had that question on my registry Friday.
You did?
I was like, what is that?
Right.
I clicked it.
But I wouldn't usually pick a word I don't know.
Right.
That's gonna get-
But the thing though, would you rather pick a word that you don't know, or three things that you know that it definitely is not? Does that make sense?
Yeah.
And so that's the trap that people fall into, because you're afraid to take that step into the unknown of, man, maybe I don't know this. Okay? So, has anybody heard of the Stressor Rails or color code at all? Anybody get stressed ever? Stressed? Okay, yeah, me. All right, so we got two tools that we're going to use. All right, we're going to talk about Stressor Rails or color code and Oona Loop. All right, Stressor Rails or color code, it's being aware of where you're at. Okay, and Oona Loop, it's a learning system. All right, and Oona Loop, the way that it came about was it was fighter pilots, and it's about decision making. So if I'm driving a plane and my enemy's driving a plane and we're trying to kill each other, who's going to win? Flying. Yes. I'm sorry. Yes. I said drive. I apologize. Yes. So The person that's going to win that is going to be the person that makes the most decisions, the fastest, the most effective decisions. Okay, and that's where Oona Loop comes in. All right, now these are going to apply when you're testing. These are going to apply whenever you're in the field. And the biggest thing is you have to understand that you have to make a decision. Indecision is still a decision. If you were choosing to not act, you're making a decision. And that decision is either going to save you or it's going to kill you. Okay? And it's either going to save your patient or it's going to kill your patient, because knowing when to do something is important, but knowing when to not do something is even more important. So the Stressor Rails color code, what it does is it essentially breaks down into colors how we feel. Okay? Where you're at. Now, condition white, this is where nobody wants to be. Okay? Because you're unalert and you're unaware. All right? And so it's white, and so it's like sheep, all right? So you hear all these stories of sheep, you know, they're always having to be protected by the shepherds and all that other fun stuff, because the sheep, they're completely oblivious until they're physically getting attacked by a wolf that anything's ever wrong, because they're provided that sanctuary, they're provided that protection, because they're unalert and they're unaware. Okay, where we want to be whenever we're taking the test is we want to be in condition yellow, because our heart rate is still the same. All we're doing is we're just taking in information. So like for me, sitting in here, whenever I know that somebody's coming through that door outside, not our classroom door, but whenever I know that somebody's coming through that outside door, I can hear the tones drop. Okay, and so that makes me aware that there's a situation going on, that somebody is coming into the building or out. Now, if I have somebody who comes into our room, then I'm going to go into condition orange, which that I have a slightly elevated heart rate, even if it's only for a moment. I'm taking in information specifically on whatever it is that's going on. All right. Same thing applies for whenever you're taking a question. You need to be able to take in all the information that you're given and then hone in on that very specific information. And based off that very specific information, you need to make a decision. Move on to the next question, go back down to condition yellow, and take in more information again. Take in new information. Whenever you're in the field, whenever you're working, okay, has anybody worked like a gunshot, cardiac arrest, or anything like that? A couple folks? Okay, so thing is whenever you're in those moments, what happens to you? What happens?
I got excited.
You got excited, right? Okay, so I still get excited sometimes. I don't get near as excited as I used to. And the moment that I knew that was we got dispatched out to a cardiac arrest, and I was like, okay, cool. And I told my partner, I was like, we're doing this, 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 and this. And then right after we get off that one, we get sent to another one. And like my heart rate didn't change. I was just like, okay. I whipped it around. It's like back-to-back cardiac arrest. And I said, okay, well, this is what we're doing this time. And I laid it out like that. Okay, now my partner over there, she was like, what are we doing? Okay, and that's great, all right? But I've had the opportunity where I've ran a lot of cardiac arrests at this point, and so I have a pattern. I have the things that I follow. The more familiar I got with the situation, the better I became at it. The more familiar you are with testing, the more familiar you are with looking at a question, breaking down that information, the better you're going to be at it. You're not going to get as stressed, and how you do that is by getting exposed to more questions, getting asked more questions. Does that make sense? Okay. And so that right there is how you turn that stressful situation into something that's completely 100% manageable. Okay. So just like whenever you're watching a movie and you see the special forces guys who are getting shot at and they're like, oh, okay, that's nothing. And then they shoot back and everything's okay. And they're super calm, cool, collected the whole time. Because they're put in that situation, they're familiar with it. They're familiar with the need that they have to make a decision. They know that indecision is still a decision. And they need to move forward. You need to have forward progress. You have 135. You have 1 minute per question. Okay? If you do not make a decision, then you're killing your time. If you run out of time, you fail the test. I have not heard of a single person running out of time and passing the exam. Does that make sense? So understand that you still need to make a decision. Whenever you start getting into condition gray, especially whenever you're in the field, this is that panic. This is that blind panic, okay? And then you have panic attacks up here, condition black. But the thing is you have to recognize it about yourself. Give yourself a task to do, okay? And so what you're going to do, the further you get in your career, the people you're around, they're not going to expect you to get into these elevated conditions. They're going to expect you to stay up here calm, cool, collected the whole time and be able to reel everybody in. So whenever I have a new person with me, a student, whenever I have a brand new firefighter and we're working a gunshot, a car wreck or something like that, and they're over there, they're grabbing a blood pressure cuff, or they're grabbing the jump bag, and then they put it back down, and then they grab it again, and they reach in and they grab a BVM, and then they put it back down. Are they making any sort of effective decisions at all? Are they making a decision? But they're second guessing themselves and they're putting it right back down. So at that point, if you recognize it in somebody else, you have to be able to orient them to a task. Hey, grab me the blood pressure cuff, hand it to me. Okay, now hold this. Okay, now go grab that. Give them very specific tasks. Give yourself very specific tasks. Okay, and that's going to be the stress arousal color code. Now, Oona Loop. Oona Loop stands for observe, orient, decide, and act. All right, and it's essentially, this is a critical thinking process. It's a decision-making process, and you have to be able to rapidly intake information. So observing, you have to be able to take in all information. I'm taking in all the information from this room. Okay, I'm taking in all the information from the question, and then the two most important things whenever it comes to a question is going to be scene safety and then patient presentation. And I'm observing all those things. If scene safety is ever a concern, that is going to be probably going to be the answer, because BSI, scene safe, those are your first steps. Does that make sense? Okay. Now, orient. You have to pick out what's relevant. Is it relevant that there is a gun on the table next to the patient? Is it relevant that there's a white powdery substance on a mirror? Is it relevant that their blood pressure is 280 over 110? Okay, that's what you have to figure out. Okay, just like what we were talking about a minute ago. Is it relevant that their respirations are 18 and non-labored? If that's the case, do I need to be focused in on that? No, unless that's what the question's asking us. Okay, and the way that only way that we know what the question is asking us is by reading the full context, understanding the context. So you have to figure out what's relevant, and our orientation is going to shape what we're observing. It's going to paint a story, because if based off your observations, you start thinking that this is congestive heart failure, when really the answer is COPD, could that be an issue? Does that make sense? So you have to be able to accurately orient yourself. All right, and that's going to be a big thing, and that's going to be on you guys in getting the material, which I know that y'all have. All right, now then you have to decide. Okay, when it comes to a multiple choice question, you have to be able to decide. You can only pick one. All right, there might be three that you like, and if there's three that you like, you got another issue, and we're going to talk about that here in a little bit. All right, but you have to, based off your previous observations, you're oriented. Your orientation, you have to decide what you know. You have to pick the one plan that fits best. The way that you do that, you have to narrow everything down 50-50 when it comes to multiple choice question. You want everything A or B. You want everything A or C, B or D. You want it 50-50. You do not want A, B, C. I know that it's one of these three. Okay, well that does you no good, because statistically speaking, you have a 25% chance of getting a question right if you just straight up guess at it. If you cross out one, you got a 33% chance of getting it right. If you cross out two and you narrow it down between A and B, you have a 50-50 shot of getting it right. Okay? And like, I'm a really, really big nerd, as I'm pretty sure you guys know. Thing is, statistics are going to be on your side if you do the process and you do it right. Okay? Now, and acting, this is what we actually do. This is us selecting our answer. This is us deciding to do that thing. This is deciding to suction before we go to breathing. This is deciding to call for additional resources before we start BVMing. That is where we're at. That's our actions. Now, your next thing, this is Oona Loop kind of getting in a little bit more depth, okay? Because the Oona Loop, you can it's constantly changing, it's ever changing, okay? If you're in the middle of an orientation and then you're like, oh wait, I didn't think about this, you're going back to observing, and then you're going to your orientation again, you're deciding what to do, and then you're making an action again, okay? And that's the big thing about this, is because it can be very quick, it can be very time consuming. It's all just depends on how you use it. I try to use this on every opportunity that I have, because the more that I use this process, the quicker you're going to get with it. Okay, and you always have to adjust your decision based off your orientation. And this is incorporating your cultural values. This is including your previous experiences. How many car wrecks have you ran? How many gunshots have you had? How many stabbings? What did you see those times? And based off what you saw, what is that going to change about what you do this time? Does that make sense? Okay, so based off your previous questions that you've been asked, how is that going to change how you answer this question? Okay? You have to loop the information quickly, and you have to choose by importance and relevance. You need to be able to narrow everything down 50-50 as far as the multiple choice goes relatively quickly. Okay, because again, you have 1 minute per question. There's going to be some questions you're going to read the question and you're going to know automatically what the answer is. And that's just it. Okay, but there's going to be some questions that you're going to have to read a lot. There's going to be a lot of thought process, a lot of critical thinking involved. Observe the information, orient yourself to what's relevant, decide, make multiple decisions, and then act. Which one of those decisions are you actually going to go with? Which one are you going to stick with? And that's what you got there. And that's what you got to keep in mind. There may be more than one right answer, but you can only pick one. All right, and this is especially true whenever you're getting tests. Right, and you always have to pick what's relevant. Okay, pick what's important based off what's relevant. If you practice the techniques, they're going to become quick and efficient. And always think before you do, and never out-act your thoughts. If you start out-acting your thoughts, this is whenever poor decisions get made. This is whenever you're going to get hurt. You're going to hurt yourself, whether it be in your test grade or whether it be in the field. Okay? If you think too quickly, you move through this process too quickly, there will be a negative outcome. But if you go through it quickly and efficiently and you practice going through it, it's going to help you. And if you do not know the why and the how behind what you do, you're wrong. If you cannot explain to me why you're putting somebody on a CPAP, you're wrong. If you can't explain to me how the CPAP works, you're wrong. Okay? Does that make sense? Because putting somebody on CPAP could be the right answer, and it very well could be. But if you don't know the why and the how behind it, then why didn't you give them nitro? Why didn't you give them albuterol? Okay? You have to be able to explain what got you there. And if you're able to explain what got you there, and you can explain it to me, you can explain it to Katie, you can explain it to Jen or Thomas, or Kip or Jade. The thing is, at that point, we can figure out where your train of thought went wrong. Maybe what part did you have a misunderstanding with? Or did you understand everything exactly perfect? And I can say, good job, go do that again. Does that make sense? So if you can explain to me why and how, you're perfect. All right? This is going to apply in the classroom as well as the field, and it builds understanding. And understanding is what we want out of this. You have to be able to understand everything. You have to be able to understand the concepts and understand what you don't understand. Understanding these steps and being exposed to the process, this is going to make you aware that it's actually a thing. This is going to make you aware of your heart rate. This is going to make you aware of your thought processes. This is going to apply on every single test that you take, and it's going to apply whenever you're doing your clinicals, and it's definitely going to apply whenever you're out in the field, because you're not going to have anybody to hold your hand at that point. Okay? And as you get more experience, as your resources increase, as you have more cultural values to fall back on, that's going to be what's important. All right? Understand that under pressure, whenever you are under pressure, under no circumstances are you ever going to rise to the occasion. Nobody ever rises to the occasion. You fall to your greatest level of training. Okay? And if your greatest level of training happens to be what you have in here, hopefully that's going to be pretty high, but you also get what you put in. So you have to go out and seek the knowledge. And you start by learning the basics and you master them. All right? Whenever I was in the Marine Corps, I was at 4th Recon Bravo Company. I don't expect any of you guys to know what that is. When I very first got to the unit, all right, I had my captain, who, or my battalion commander, he came in, he talked to us, there was 3 of us that were there, and he said, hey guys, so what do you think? What do you think about where you are? And I'm like, oh, okay, well, I think we're okay. We just spent, 6-7 months going through all sorts of training, going through patrolling, riflemanship, all these things. This guy, he's been in service for 18 years, okay? he's been practicing what we've been doing his entire career. And he said, okay, so we're sitting there and we're talking to him, and he said, well, what do you think the difference is between you and me? And, you know, we're looking at his chest. We can see all the schools he's been to. We've seen that he's been to jump school. He's been to dive school. We see that he's been to Iraq, Afghanistan. He's literally been all over the world, and he's got combat action ribbons. Okay, he's got a Bronze Star. Okay, and with valor. What that tells us is that he's been in combat. He's been there. He's seen it. He said, "What's the difference between you and me?" He said, "Well, you're significantly better at everything than we are, for starters." And he said, "No. Well, the difference between you and me is you guys have just been exposed to the basics. I have spent the past 18 years of my career mastering what you've spent the last six months learning." He has become, throughout his career, he's become a master of the basics. And that is what makes a paramedic. That's what makes an EMT. That's what makes you good at your job, is understanding the basics, becoming a master of the basics. And that was the only difference between he and I. Okay? He had understood the basics, and he had taken them to a level of mastery. And that's what we need out of you guys with this class. We need you to take the concepts, understand them, and master them.
Guys, you don't realize this, but even all the way through paramedic, a lot of, like, especially airway answers were always basic. It's always OPA is better than intubation. Always. And it's always least invasive, always comes first, because it does the least harm to your patient. All right. So we're entering as technically a basic skills, taking our paramedic test. So just don't look at basics as being simple or not as important. Right. Your ABCs are the primary things to saving somebody. Right?
Absolutely. And that's why we harp on it.
Misconception.
The difference between a master and a beginner is the master has failed more times than the beginners even tried. Okay. Taking that back to the concept of my captain, he's been shot at, and he's missed more shots than I've ever even attempted. Okay. Difference between Thomas and me is Thomas, he's been intubating people for years. Okay. He's got so much experience under him, like I can't even fathom getting on his level right now. You know, and that's the difference. Okay. So take that. We're expecting you to understand the basics. We want you to understand what you don't understand and go seek that information. Go seek that knowledge. And that's all we want. So, you guys feel okay about the critical thinking aspects? You're aware of the concepts, aware of the processes behind it? Cool. And if you think about thinking, then you'll be okay.